All right, so let's go ahead and get started. And we will have folks join in as they can. Thank you all for attending today. I'm delighted to kick us off on our second part of Dr. Abbott's evaluation lecture series. Today we're talking about using using your logic model to build your evaluation plan. I inserted an extra logic there, although presumably we also use logic to build a logic model. So we will learn about all this and more. So this is the continuation or building upon our part one, which if you were able to attend it or were not able to attend it, the materials from that session is available on our continuing education website. I'll drop the link into that into the chat after I'm done talking here. But thank you again for joining us, and thank you especially to Dr. Abbott for this second session. We're delighted to listen and learn. So without any further ado, take it away. Oh, sorry, one further ado. Please feel free to drop something into the chat if you have questions. We can address them either live if it's a sort of a clarification question, or after there'll be time for Q&A at the end. If you're feeling a little shy, you can always just send it directly to me and I will read it anonymously. So without any further ado, now please take it away, Dr. Abbott.
Great. Thank you so much, Mac. And thanks for everybody for coming. I see some familiar faces that always make me happy to see, especially on a beautiful sunny Tuesday. Good to be here with good people. So today, like Dr. McCullough said, we are really launching into the continuation of what we talked about a couple weeks ago, which was why a logic model is important, why we need it in the first place, and kind of our impetus for going on this evaluation journey together. So I will warn folks today, I just got a new computer screen and this is a little bit of a new computer setup for me. So hopefully you don't see anything totally wackadoodle, but if similar to when I have food in my teeth, I appreciate if someone would just go ahead and tell me rather than watching me make a fool of myself and letting me know later. So please drop something in the chat or something if you are not seeing things or things are not coming up well for you.
Things are looking great right now.
All right, good stuff. Thank you. I'll count on you next time I have like parsley or cilantro in my teeth too, Mac. Okay. All right, so it is great to see all of you again. If we could start off today by if you're here representing an organization, great. If you're just here for your own knowledge, that's honestly even better. But if folks could put their name and where they work and where they're joining us from today geographically in the chat, that's really helpful to me as well as the kind of hosts of this meeting and figuring out who we have in the room. So if folks just want to give you like 1 minute to go ahead and put some of that in the chat. I see people typing. Lisa, welcome. Natalie, hi. Crudy. Tracy. All right, lots of good folks coming in. So as I'm kind of yapping on the front end, other folks can also get a sense of who else is coming in the room, which is always really helpful. All right. All right, so in terms of what we are going to cover today, I'll give you a little bit of my spiel of what I gave last time, which is this is really an introductory overview of evaluation. So unfortunately, we're not going to take a super deep dive into a lot of this stuff with the understanding that sometimes the terminology around evaluation can be difficult. It is a jargon heavy field. Evaluators love to drop acronyms, live in the alphabet soup, use a bunch of complicated terminology that makes us feel really smart and good about ourselves, but confuses most people. So we are going to take a nice, warm, comforting walk through all of that together. But for some of these things, if you want to go deeper, I would encourage you to either send me an email, or there's a lot of other people on this call today who are also experts in this space. I see Dr. Baker, Dr. McCullough, of course, Dr. Rock over in the School of Social Work as well. So please go ahead and if you have things that you want to go deeper on, go ahead and follow up with us after the call. So generally, we're going to start by picking up where we left off after last meeting with talking about logic models and doing some process checks on those logic models once we have them completed. Next, we're going to talk about using your logic model to create an evaluation plan. And then last but not least, certainly talking a little bit about sharing, dissemination, and managing the plan. So just as a quick level set, right, when we talked about program evaluation last time, this is in general the kind of definition in the space that we are living in. So when we're talking about program evaluation, what we're talking about is the systematic, meaning not willy-nilly. It means it's planned, it's thought out, it's meaningful collection of information and data that answers specific questions that you have about your program. Also, evaluation data and information can be used to make judgments about the program as well as improve program effectiveness. And you may remember from last time when we say judgments, oftentimes people take that to mean, oh, my program's going to get automatically defunded, but that is certainly not always what we mean when we use that word in this space. So also just a couple of reminders about when I'm talking about program evaluation, a couple of things that I find really important to thinking about program evaluation as a field, right? One of the biggest ones is that it's true at the same time that doing something is better than doing nothing when it comes to program evaluation. So if you're new to this space, it intimidates you, you're worried about it, and you're just getting started, we don't want to scare anybody, we don't want to stigmatize anybody, we don't want to like move someone away from thinking that evaluation is not something they can do and it's not something they should be doing, right? So in the same way, I don't think my personal actions are going to do really all that much for the trash heap in the Pacific Ocean. I am still going to take individual actions like recycling, right? Even though I know more action is needed than just one individual thing. So doing something is better than doing nothing. On the flip side, right, checking an evaluation box, especially if you've had your program in place for a long time and you've been sitting on the same root of evaluation data, letting it collect dust or letting it sit on your filing cabinet and not using it to collect your program, checking the evaluation box and calling it a day is not cool and is also not good evaluation. So in the same way that we don't want to scare away newcomers and evaluation really is for everybody, we also need to recognize that evaluation is about program growth and evaluation is about getting better. So we have to hold those two truths together at the same time. Also, just to remind ourselves a little bit, right? Program evaluation, and this goes back to what I was saying about judgments, right? And it's not always about penalties and punishment and shutting bad programs down, though it is sometimes about that. Evaluation as a field is really about continuously learning and growing as a program or an organization, right? Usually what we're needing and usually what we're using evaluation data for is making small tweaks and adjustments to our program to optimize it, make sure it's serving our populations better than it was before, or adapting with the changing times, right? However, in that same beat, right, occasionally we do need to change our strategies, right? And sometimes we do need to abandon things that have been shown to not work, right? And sometimes that also means reallocating resources, right? It is a little bit of a mindset shift to think of this as an opportunity and not a punishment. But if we go back to thinking about who we're ultimately responsible to, which is not us as program staff, it is the people we are here to serve or the populations that we are trying to create change in, hopefully we can see that as an opportunity and not something that is a negative punishment or a penalty. So when we are thinking about using our logic model and using some of that information we learned in our first awesome session together, right? What do you need to create a programmatic evaluation plan? Well, certainly you need a current and accurate programmatic logic model. You need at least an 80% done, completed, and accurate programmatic work plan. You also need some dedicated work time and time to get feedback from others. So, you know, like we always tell our students here at the university, doing it the night before it's due doesn't let me help you when you run into problems, right? You're doing yourself a disservice if you're doing it at the last minute. And also a healthy dose of patience. Specifically, if this evaluation is something that's new to you or something you're doing unsupported in the organization you work for, a healthy dose of patience is going to be your friend. All right. So when we think about creating a programmatic evaluation plan, there are some pretty well thought out steps, and different people will tell you how these steps lay out a little bit differently, but I feel like distilling it down to 5 feels pretty like warm and gooey and friendly. So particularly thinking about what we need to do and how we're going to talk about it today, we're going to talk about doing logic model process checks once you've completed your logic model, deciding on an evaluation framework, determining what you need to know and forming evaluation questions, developing indicators and finding data sources, and then writing all things up, right? Creating a written plan for how you're going to do all these things. So let's start with our process checks first. All right. Oh, and I see a couple more people in the waiting room. Go ahead and admit those. Okay. So just a reminder, why do we talk about logic models when we talk about evaluation, right? Especially if you've taken a course on program planning, you've been working in the field a really long time, you're like, yeah, I know. What do logic models have to do with evaluation, right? What logic models and good program plans actually do is help us go from these really basic formulations of our programs to more advanced forms. So thinking a little bit more specifically about how we want our programs to evolve and how we want our programs to serve people and show actual population level impacts, right? We really want to move away from hopes and dreams, happy, warm, fuzzy feelings that we feel like we're doing a good job, but we can't actually show that that's the case, to moving along a continuum where we're getting more advanced and doing a better job. And that helps us not just as program staff to feel better about the work that we do and help our population, but it also helps us grow our impact because it helps us do things like improve the evidence base, as well as get bigger and better grants as we're moving along that continuum, right? So we've probably all been in a situation where we've gotten a grant, gotten it for 1 year, and we're like, well, what am I supposed to do after that? They said I can't apply for another one. I know specifically that there's at least 2 of you on this call right now that are in that situation, right? That sucks, but that is the world we live in public health, is people love to give us 1 and 2 year grants. If you want the big money, right, you want the 5-year grant and you want to show consistent impact over time, evaluation is a big part of helping you get there. All right, so thinking about our logic model process checks, right? These are some of the big areas that I often look for when someone says, yep, I have a finished logic model and I want to know if it is actually a good logic model and one that is going to help a program advance their success. So accuracy, completeness, and detail, context and assumptions, the actual logic of the logic model, to Dr. McCullough's point about there being logic and an actual flow, alignment with funder requirements, and then verification with partners. So when we talk about accuracy, completeness, and detail, all of these are obviously not mutually inclusive or exclusive and obviously highly related, right? So what I'm actually looking for when people turn in a logic model to me as an external evaluator is, does what you have written in your logic model actually reflect the reality in which you will be conducting your program and which your program actually exists, right? And so this is actually a lot harder than it sounds. Sometimes it's really hard for an external evaluator to assess some of these things, but what usually happens is some sort of guided conversation with a lot of folks from the program who can actually tell me, are the things on here realistic, right, and relevant to what we're trying to achieve. A good kind of indicator of this from a very basic level are all of your major activities and goals included in your logic model, or did you forget things? Are there big gaps? Were there program strategies you were still figuring out when you were writing your grant that you forgot to put in because they've now been solidified, right? So remember, logic models are supposed to be visual overviews, right? They are not meant to include everything. And this is one of the biggest mistakes I see with people who are newer to logic models. So particularly with this idea of what level of detail or what balance belongs on a logic model, right? We can think about it about the view from our plane windows, right? So if we're talking about the 40,000 to 50,000 foot level, that is just the overall goal of your program, right? If I'm in a plane and I'm at cruising altitude going a decent distance, all I can see is clouds. I cannot see the world below me with any level of detail. Maybe I see some different color relief, right? What we're aiming for in the logic model is really that 10,000 to 15,000 foot mid-level overview of a program, right? Where I can see some of the things below me, but not all of them in great detail, right? So conversely, I also don't want to be so detailed in my logic model that I'm the paper plane, right? And I can see the faces of the people whose eyes I am about to poke out, right? That is also too much detail for a logic model. So we're really trying to get in this balanced case of not the 747 going to Europe or someplace else, not the paper plane poking a middle schooler's eye out, right? But good mid-level, I can see some level of detail and understand how things move together, but not entirely every piece of detail. So a good way to think about this using our plane analogy, right, is when you are at about 10,000 to 15,000 feet, right, you can see your neighborhood, you can see your community, but you can't see inside your neighbor's house. This is exactly what we're aiming for with our logic model. Do not put every detail of your program on there. Do not put every process within your program on there. This generally needs to fit on a page. So you need a general overview. So some common problems I see with the accuracy and completeness, other than people either providing way too many details or not providing enough details, right, is oftentimes in the input category, people are not always 100% honest, or they are being misled or not being thoughtful about what their actual inputs, like their budget and the capacity are. The logic model for a $10,000 grant or a $10,000 program looks a lot different than a $50,000 program, right? Or a $100,000 program. The logic model for a year-long program looks very different than it does over 5 years. These are realities. Your logic model should not be the same, right? And if you're reusing a logic model from before, that might be a little bit of a special case, but in most cases, you need to right size your logic model based on the inputs you actually have available to you. Also, in the activities category, a lot of times what I see is too many unrelated and developmental tasks that people are putting in here, right? It's especially for those of us who like structures and lists, and for those of us who want to like get our stuff done, right? We want to nail it down and say, I want to check these things off the list. Again, this is a little bit antithetical to the idea of you don't want every detail in your logic model, right? But then also there is just you want the broad strokes of what is the main thing you are doing. So if you're giving me every developmental tasks of, I will go ask this person, and then I will write this down, and then I will ask this other person about this thing that I wrote down. That's too much. That doesn't belong in your logic model. That may be in your work plan or just your daily to-do list. Also, I tend to see a lot of confusion between outputs and outcomes. This is very common. It's not something to be ashamed of, right? The big thing to remember if those things are confusing you is, one, go back and look at our recorded presentation from our first of these, where we talk about the fact that an output is something that's happening in the immediate term and often captures things like participation or reach. And then their outcome is really what is happening as a result of those things. So if I say I'm hosting a training, that is the participation. The output is the number of people that came to that training, and my actual outcome is probably something like knowledge, attitudes, or behavior, depending on the length of the grant I'm looking at. So I will say mitigating all of those problems depends a lot on when you're making your logic model or amending your logic model and turn it in, right? So if you're making your logic model before you get a grant, you might not know all the fine details of your program yet because you don't know your final budget and you don't know any of those things, versus if somebody gave you money and then you're building a logic model after. So some of those things you have to take into consideration in terms of when you're building it and when you need to make changes. All right, so moving on to our process checks for context and assumptions. So specifically when we're thinking about things like context, external factors, and assumptions. For those of you who are on the first version of the call, you might say, what are all these things? We didn't talk about them. I didn't talk about them in our very introductory training because I see people get really wrapped around the wheels with these things, right? What's very common when you're new to logic models is you have a great time filling in your inputs category, a really fun time listing out all the barriers you're going to have to doing your program because we're in public health or population health. We love to vent about the things that are vexing us. We need that release. But ultimately, it's not always super helpful to your logic model. So I did include the University of Wisconsin Extension logic model. They are one of the founders of this idea, right? And so you will see some logic models that include things like assumptions, context, and external factors. Feel free to include these on your logic model if that is something that is helpful to you. If it is something that you think is going to get you as the leading staff member or other members of your team wrapped around the wheels and marred in details that maybe don't actually affect how your program's going to run, I would recommend either putting it in a totally separate document or just having it in something like your planning documentation, right? So you could have it maybe on your logic model, you could have it in a program plan, you could also just have it as a narrative section in your evaluation plan where we talk about later. So not to say that any of these things are unimportant, just to say they don't necessarily always have to go on your logic model. I will say though, especially if you are a newer program and you haven't done something like a strength, weaknesses, opportunities, and threats analysis, and if you don't know what that is, Google it. The internet knows what it is and it can help you figure it out, right? It's not super difficult. Right? It is useful doing that when it's a newer program or if you're a new staff member to identify some of those things and make some of that explicit, right? A lot of times we walk into new programs and we're walking into a minefield and don't even know it. Doing something like a SWOT analysis can be very helpful. Like I was saying, with all of the things that go in the bottom of the University of Wisconsin model, you don't have to put it on your logic model if you don't want to. And also in many cases, your funder may have an idea of what belongs on your logic model. So if your funder tells you you have to put assumptions and external factors on there, put them on there. But if they're not helpful to you from your internal perspective, do what works for you. All right, in terms of our actual logic process check, right? Now, I know X and Y scare some people. It kind of flashes me back to high school algebra. It's a rough time in life for many of us, right? But the basic concept we're going for here, remember with logic models, is it reads from left to right. It goes in a logical sequence. It's a series of if and then statements, right? So we can use those really basic parameters to check what we're doing to see if our logic model is actually doing what it's supposed to be doing, right? So does the box on the left actually relate, cause, affect the things immediately to the right of it, right? Have you clearly laid out the path by which your change will happen as part of your program and who that change happens with, right? Sometimes we're directly intervening with our population that we want to create change in. Other times we're intervening with populations that affect them, or we're trying to engage in systems work or PSC level, policy systems and environment level changes, right? So write those things down. That is an appropriate level of detail to have on your logic model. Obviously, this idea of having logic and having accuracy, detail, and context within your logic model are all highly related. Like I said, they're not mutually exclusive ideas. So when it comes to understanding whether or not your logic model aligns with what your funder is asking for, to be totally honest with you, not even all funders require a logic model. I would encourage you, if you are in that situation saying, why would I do this if my funder doesn't require it, to think more deeply about your long-term goals for your program and organization. The more sophisticated funders all require programmatic logic models. Every federal funder requires a programmatic logic model, right? So if you're okay getting 1- and 2-year grants, and that is the life you want for you and your organization and program, is to constantly be grant writing and constantly be doing things that are these drop in the bucket 1- to 2-year things, maybe this is okay. For the longevity and sophistication and impact of your program, I would encourage you to think more deeply about this, right? So in terms of checking whether or not this aligns with your funder, if your funder has given you a logic model template, use it, do whatever they say, make sure your definitions align with what their definitions are. Also be really clear about what their timeline is, right? Some people give you a 1-year grant, but want you to show an abstract out what your 10-year impact is going to be, right? So understanding what are the actual things on my logic model that I am directly accountable for as part of this grant versus what is an in theory thing that I will affect. For those of you on the call that know me through my violence prevention work, this is incredibly common. Violence prevention is obviously super hard to measure, so we love to put things in that long-term outcome category that we never actually measure, or we only measure in theory. Also, just check in with your funder on the format of your logic model. Like I said, some people will require certain boxes, will require a certain level of detail, and will actually require you to have your logic model approved by them before moving forward. So check in on that. Also, make sure your accompanying documents align with what your logic model says and what your funder wants, right? So this usually goes well beyond just whether your logic model lines up. Lastly, and maybe most importantly, but also related to all of these other process checks, is verifying your logic model with your partners, right? So remember, your logic model should, without that much explanation, right? So without having to give a 30-minute long presentation, someone off the street should be pretty able to understand what your logic model says, right? And say, hey, this is a program, this is what it's meant to do, right? And once you explain what a logic model is, somebody should pretty easily be able to pick it up and understand that. If it's not, that is a sign you need some edits, which is exactly why we engage partners and additional friends and staff, and sometimes frenemies, in making sure our logic models are good. So when specifically thinking about who to engage, this is kind of my own personal thought on who is most important versus who is least important. Apologies to supervisors and managers that are on the call. My number one thing is, if you are saying you are going to, that your program is there to serve a specific service population and you have not engaged with them in any way for the creation of your new program, like go back to step 1, right? Kind of basic program planning principle there. I say that smarmily, but it is easy to forget, right? Because we put our heads down, we get bogged down by paperwork, we're busy doing the administration of programs, making our funders happy, on and on, right? But carve out time to go and talk to your service population. It does not have to be everybody in your service population, right? I've done a lot of great work with things like advisory committees, right? Or community representatives in the past, right? But if you haven't at least gotten it past the people that you are aiming to create change in, or the people that you are aiming to benefit, that's not really like a great sign for the longevity of your program. You can also think about making sure, if you are a manager or a supervisor, making sure your service providers and frontline staff are bought in on what that logic model says. It is pretty common that people build logic models for a funder and then forget about them. They never see the light of day again. That is not what a logic model is for. That is not a good way to use a logic model, and that is literally a waste of your time, right? So doing this work on the front end of making sure everybody on your staff is bought in, but especially the individuals who are going to be responsible for directly offering a program or providing some sort of services is also really important. From there, I also find it really useful to engage with folks from other programs and folks who maybe know nothing about the program I'm operating, because it's a really excellent check on how clear my logic model is, right? The less somebody knows about the program, the less blanks they can fill in by themselves, right? It really makes me test my programmatic logic. And then last but not least, right, if you are in a larger organization with a supervisor or manager who is going to be holding you accountable for what your program achieves, sharing that logic model when you develop it and making sure they have a really great understanding of what's going on there and how you're spending your time, whether it's supervisory or otherwise, can be a really meaningful activity. And also, they might have some good feedback. I can't guarantee it, but they might. All right, next step, we are moving on to our next step, which is deciding on a framework, right? So once we've done all of these process checks, we need to decide on an evaluation framework. There are very, very, very many evaluation frameworks you can choose from. Within specifically the public health space, most people are big fans of the CDC's evaluation framework, which they have just redone in the year 2024, which is really exciting. So this is actually their newest model and their newest framework, right? So it has more standards, more steps, and more pillars, which more is not always better. We'll see how it goes, but I tend to think it's a change for good. In the notes from these slides, I do have a link to this on the CDC page, by the way, for any of you that want that. Also, another very common framework we see in public health, a little bit more on the academic side, but it pops up a lot in federal grants as well, is what's called the re-aim framework. I will tell you the re-aim framework has some great components that can really help you think critically about what goes into an evaluation, but the re-aim framework was developed around this idea of how we spread the evidence base and how we expand evidence-based programs. So while it is a cool framework and the idea of reach gets stolen very frequently from this, the re-aim framework is not always totally appropriate, but it is very popular. So I figured I'd cover it at least a little bit. So there are, like I said, very many frameworks out there to choose from. Again, some of this might come from your funder. Your funder might say, our framework is this is what you'll be using. Again, sometimes you just have to follow those rules. Sometimes that's how it is, right? But which framework you use, right? Sometimes you can say, okay, funder, this is your framework. This is a framework I like. Could I figure out a way to combine the two? I've actually had a fair amount of success doing that on the days that I can put a smile on my face and be nice to other people. Other times, not so much, right? But if you are funded by the CDC, you are required to use the CDC framework. Sometimes you can add some additional stuff on there, right? But they're not going to let you step too far out of line in terms of what you're using. Also, what framework you use is incredibly dependent on what your program model is and how big your program is, as well as how sophisticated or how long your program's been in operation. Like I said, it's very different if you're saying, oh, I'm going to disseminate an evidence-based practice and track my program's effectiveness at spreading that evidence-based practice in something like a health center, or track home visiting programs and how much they're using nurse-family partnership versus parents as teachers or something like that. Those require very different evaluation frameworks versus a program that's brand new where you're still testing a lot of things out. Lastly, if you are internally evaluating something, you get to pick. But if you are working with an external evaluator, like somebody like me or Dr. McCullough or Dr. Baker, you would probably be very dependent on what that external evaluator wants to use, right? They may not put their foot down and say, I'm not using a different framework, but they might have strong ideas on frameworks that they like to use. All right, so moving on to our next step, determining what you need to know and forming evaluation questions. Right, so the reason we have focused so much on logic models and the reason I love them so much and use them so much in my practice, right, is that we want to use our logic model, not have it gather dust, not have it sit on the shelf, right? We want to use our logic model and work plan to help us focus in on what matters to our actual program. So for the vast majority of programs, right, the best fit in terms of conceptualizing your evaluation questions is a mix of questions related to your short and medium term outcomes and whether or not those occurred as you thought they were going to occur and whether your activities and participation went as planned, right? So when I look at my logic model, I'm looking at my darker blue boxes for my activities and my participation or my outputs, and then my short and medium term outcomes. This is not universally true. Like I said, a lot depends on the program. It depends on your funder. It depends on the environment in which you are implementing your program. But for most people, this is really the sweet spot for most evaluation. So we have fancy names for these things, and we introduced them a little bit in our first session, but just to reiterate, right? So when we think about things like outcomes, right, usually refer to that as outcome evaluation. That's also part of a larger field called summative evaluation, right? Where we're looking at what our programs actually did or what did they achieve, right? So questions about did the short-term or medium-term outcomes occur in my target population or my beneficiary population or whoever I said I was going to create change in, right? And so I'm looking at those outcomes columns. For process evaluation, right, I'm trying to look into that black box of not just did change happen, but why it occurred, right? A lot of times what happens in evaluation is we answer one question and we just end up creating more evaluation questions. Some people look at that as a negative outcome. I think that is an awesome outcome, right? Because evaluation is about learning and growth and better understanding our programs to understand the effect that they are having on our communities that we're serving, right? So when we're thinking about process evaluation, right, we're focusing in on questions about did we do what we said we would do, right, at the beginning of a program? So if I start in October, which is when many of us start programs in public health and healthcare, by January or by next September or next October, right? Did that play out the way I thought it was going to play out, right? And so it makes sense, right? Because we're focusing in on our activities, what we did, as well as the participation in them or the outputs, right? The immediate things that happen because of those activities, right? Thinking through, did those actually happen the way I originally laid them out? So I actually live a lot in the formative evaluation world because a lot of the work I do around health communication and messaging requires a very high level of formative evaluation. If you are not doing a ton of health communication or health education work, or you have a strong evidence base around the work that you are already doing, you may not be doing all that much formative evaluation. That's okay. Evaluation looks different for different types of programmings. Not everybody should be doing the same types of evaluation. We would never learn anything if that was the case. But when we're thinking about formative evaluation, right, what we're really focusing in on with formative evaluation is whether or not our inputs are the right inputs and whether they are high quality, right? Do I have a snowball's chance in hell at making this work, right? If my program components aren't quality from the get-go. So this is really popular and really common when I'm thinking about testing or adapting things like messages. So like I said, I do a lot of work around health communication campaigns. So I'm often testing them with a target population. If I'm doing cognitive interviews, testing out instruments, right? I might look at curricula and make sure that's high quality and a good fit for my target population. So especially if you are trying to adapt something that's worked in one population and adapt it to a new group, formative evaluation might be a really meaningful step for you, right? Generally speaking, formative evaluation is not something you're doing at the end of a program, the way summative evaluation is done, or even while the program is going full swing. Formative evaluation are like the little baby steps you take at the beginning to ensure that your evaluation, that your program has the best chance of working, right? So if I'm doing a training, pre-testing it, making sure the training at least works for a small group before I implement it with 1,000 people, right? So especially when I think about the university context here at BSU, we do a lot of stuff, right? Where we just take it as proof of concept, we just take it on faith that, hey, this training's gonna work really well. We created a training, checked that box, right? Do we know that the training works? Do we know that the training worked in even a small group of people? Oh, we don't? We're only going to find out at the very end of our program that the problem was not that we didn't get people trained, it's that our training inputs were garbage. Not great. Waste of money, waste of time. Nobody's happy at the end of that process. So formative evaluation can save you a lot of pain and struggle. Also very important, but more on the academic things. Impact evaluation, right? So as I already said, different programs have different ideas of what long-term impact versus shorter-term impact is, right? But any kind of measurement we're trying to do, we're asking, did you achieve your big goal of change in the target population, right? So for most public health and health-related programs, was there population level change? This is not always appropriate to measure for a newer program, right? Sometimes we want to see that ducks are in a row before we get to that big question, right? Give people time to shift, make tweaks, right? We don't want to throw the baby out with the bathwater. But this also, it's a form of evaluation, requires a huge amount of time, money, and resources to conduct well, right? Really solid methods are incredibly important when we're talking about impact evaluation. So it's a very important piece of evaluation, but this is actually, I would say, if you are interested in doing an impact evaluation for your program, that is usually the point at which you would come and visit your friendly university or other evaluation professionals, right? These are hard and these are resource intensive. There's also a bunch of additional types of evaluation. So economic evaluation, which is pretty advanced, but we have experts here in BSU. Developmental evaluation for those of you running really complex interventions or wanting to evaluate collaborations. Needs and strengths assessment on the front end of just trying to better understand what's going on in a community or in a specific population, as well as kind of measurements of organizational effectiveness. Obviously, this is, again, just two trainings. We cannot get into all of these, but there's a lot of different ways to evaluate. All right, so thinking about developing indicators and finding data sources. So when we think about our evaluation indicators, the most important thing we need to think about with indicators is that they need to align with our actual evaluation questions, right? So deciding, am I doing formative evaluation? Am I doing process evaluation? Am I doing a mix of all these things? And then developing indicators based on those things is really important. We're going in a sequence. You can certainly have multiple indicators, and for most people, I actually recommend that you have multiple indicators per your evaluation question. Generally speaking, we're not running something like a randomized clinical trial here, right? We cannot usually say this for certain caused this, right? So having multiple indicators that help us get closer to the truth and help us triangulate what's actually going on are really helpful. Our indicators do need to be measurable. People often think when I say measurable, what I mean is quantitative, and I can tell you that is not true. You can have qualitative indicators, particularly in process evaluation. Qualitative indicators are totally acceptable, and they can still be high quality, although they are not always appropriate. Also, your final indicators that you build into your plan really do need to be realistic, similar to your logic model. You need to live in reality, but sometimes it is useful on the front end to just get some things down and brainstorm to figure out what is realistic, especially if you're just getting started. So these are just some example of indicators. We talked about these a little bit last time, right? So if I'm thinking about something like a program for preventing high school dropout, actually measuring things like absenteeism or dropout rates are an example of an indicator that I would use for an outcome evaluation. If I'm thinking about a program for implementing colorectal cancer screening or breast and cervical cancer screening, right? Looking at the increased rates of screening within my clinic or within different subpopulations is also an example of an indicator. Moving on to process, right? If I'm thinking about things like a training program or something that's educational, right? Looking at the number and proportion of training participants that said they would recommend the training or something like that. Not always the most valid indicator, but all examples of indicators that you can be using. So just a reminder, like I said, for most programs, you are going to be doing a mix of outcome evaluation and process evaluation. That is what is required most frequently by federal funders in particular. So when I'm thinking of specifically about outcome evaluation, right? If I'm thinking about something like a short-term outcome that I am trying to develop, right? So like I said, one of the most important things is having alignment between my evaluation question. So my short-term evaluation question is, in this case, Did our bystander training program increase participants' knowledge of how to intervene in situations involving stalking, right? So yes, I can see who would recommend the training, right? But if I'm actually trying to measure knowledge, which you remember from our first training was a good thing to have in our short-term outcome category, things like the proportion of participants that reported knowledge change is a really good indicator, right? Now that's a quantitative one. Obviously, I can measure that by something like a survey or an assessment or something like that. But like I said, it doesn't always have to be quantitative. So once you have an indicator in place, you're going to need to figure out how you're going to get that information or data. It is not uncommon when people are building evaluation plans that they spend a lot of time brainstorming indicators, taking them back to stakeholders, and then figuring out, is this an actual useful indicator, right? So if that's happening to you, that is no cause for concern. You're doing the right thing. So thinking back to your research methods training. Now, if you don't have research methods training, that's no harm, no foul. We start where we start, but some of us have taken some level of introductory research, right? We're familiar with terms like surveys, interviews, secondary data. If those terms are scary or you feel like, oh, I've heard them, but I don't know what they mean, or I don't know how to do them well, I would really encourage you to come talk to us. We'd love to help out with some of these things, but also like, we have the internet. The year is 2024. You can learn a lot about how to do these things and how to do these things well from a variety of sources online. All right, so thinking through how do I put these things together for a plan, right? So if I'm thinking about indicators, from that flow my methods, right? So I have to think about if I want to do a survey for my bystander program, does that survey already exist? Does somebody need to build that survey? Do I need to build that survey? Do I have to come up with my own questions? Could I rob somebody else's questions? All things you need to consider for you and your team, right? Also, I want to think through things like analysis. With the vast majority of process and outcome evaluation, the analysis we're running is usually pretty simple, right? So things like descriptive statistics, so frequencies, proportions, counts, how many people did this, what percentage of people did this, right? Most of us have those skills. If you don't know something you're working on, like I said, get into contact with us. We can point you in some towards some resources, right? But particularly thinking through when you're putting things into an analysis plan, what can you do for yourself? Where do you need help, right? Is there somebody at your organization who is good at Excel or good at Google Forms or SurveyMonkey or Qualtrics or any of those things who could help you out, right? And then also, if there's cases where you feel like you do need a better analysis or you're not sure what that analysis is, how are you going to figure those things out? So putting this all together, right? Actually creating the plan. You are just going to create a long document, right? And like many other things that I have talked about here, all of this flows from who your funder is, what your requirements are, and whether you're doing this because you want to be a good programmatic steward or because you're being forced to by a funder or multiple funders or your manager or supervisor, right? So in this document for your evaluation plan, if you are using the CDC's framework, they have very detailed guidance for how to put this together. If you're just doing it itself, these are some of the basic steps from that plan that are distilled here. So you want to combine your logic model, your contextual information and assumptions that you talk to you or your team or other people in your organization about, and combine that into a written narrative, right? You want to get that down on paper and document it. Also, sometimes it's really helpful to include a background of how the program came to be, right? So a lot of times what we have is things like other programs that showed a need for this program, existing data, right? Sometimes we have, if any of you are familiar with like the United Way's ALICE data, right? We have community level data sources that show us there's a need for this program. That can also be helpful to include in a plan. Next, we want to write up all those eval questions that we developed based on what we think is important or what our funders are requiring of us, line those up with our indicators, our methods, and our all good? Everybody thumbs up?
Yes.
All right, cool. All right, so before we got cut off, right, we were just talking about all these things we need to put into our evaluation plan, right? And these are just the very varying components of it. Right. So when we're thinking about writing things up, like most things in evaluation, we get asked to do things, we check a box, and then we spend all of our time doing it and then promptly forget about it and move on to the next thing because we're busy, important people with busy and important things to do. These are a couple of ways I would suggest using an evaluation plan to actually make sure something happens with it. One is print out a paper copy and keep it on your desk. If you're like me, all of your evaluation plans will have fun coffee rings all over them by the end of the year, or spaghetti sauce or Penang curry in my case. But it'll show that the evaluation plan is well loved and is actually have a chance of being used, right? Also, right, you want to actually implement your plan, right? But document any big changes that you're using as you go along. And the other thing to think about, right, is using your evaluation plan on the front end is pretty much just you getting a jump on writing up your final evaluation plan at the end, right? Because like I said, when you're creating an evaluation plan, you want to create this way of thinking through who you're going to share your results with that's beyond just you. So you're getting a really good jump on that by having it all frameworked out on the front end. All right, and if you're thinking of all of this as what the hell, why would I spend my time doing all of these things? This is so much effort. What are you talking about, Anne? This is the worst. I feel you. We have all been there, and like I said, we are all busy, important people doing a lot of things. Most of us don't run just one program, and I feel that deep in my soul. Right? But if we actually end up thinking about why we're doing all of this, which is really improving programs for the people that we serve, right, I think why we evaluate and why we would bother putting ourselves through these processes and administrative headaches can really help us become a lot clearer. In the same way, right, where we can't really try to judge ourselves based on our worst day at work, right? Refocusing, finding our why, all of that good stuff is important. All right, so I am so sorry for the technical difficulties, but I appreciate all of you hanging on. What questions do you have, or what areas could I help out with our remaining time? And you can throw it in the chat or unmute yourself, whatever you prefer.
I'll get us started here, I guess. Can you talk a little bit about when it comes to indicators, sort of balancing the need for, like, you know, the data you have versus the data you want, and maybe even the data that you have now versus the data that you might have in the future, and sort of like balancing the practicalities of indicator selection with like the more rigorous analytical evaluator side of your brain.
Yeah, and I will say, like, I'm kind of a bad evaluator, like, just for Tracy will laugh because
You're a
she's
great
heard me give
evaluator,
this.
but
Yeah, I'm not, I am a big fan of not letting the cart, like, not putting the cart before the horse, right? At the end of the day, we all work in fields that do not have enough funding, do not have enough time, do not have enough resources, and are not, right? Like, we do not live in an appropriately resourced place, both in terms of time and space. So I feel like we can't ever really say, oh, well, we need a crystal clear evaluation measure about this, so we need to spend all of our money spending $100,000 on a survey to make sure that we have a perfect measure of this that is appropriately like, right, appeals to whoever taught us about research methods, right? I'd much rather have 3 or 4 indicators that all kind of buzz around what is actually happening in reality, and I can all use as information that things are working, using it as evidence and data that my program is working the way I think it is working, especially if my program is newer, especially if my program hasn't evaluated itself before. This goes back to that kind of hokey Pollyanna thing I was saying at the front end of, we have to hold it true at the same time that, like, we can't just check an evaluation box, but doing something is better than nothing. It is better to measure indicators and have a little less faith in them and have them be a little bit more rigorous than spend all of our programming money on evaluating something that we don't even know that there's proof of concept of. I will always put emphasis on spend money on your program and less money on measuring. So I think cost is a huge piece for people, right? And that's something that when we're learning about research methods, we don't always talk about the fact that good data is expensive data. So I feel like price is a big one. I do feel like too with indicators, I always encourage people when they're making indicators for the first time to be aspirational and say, best case scenario, how would I measure this, right? Get it down on paper and then return to it later and say, okay, so if that's not feasible, what do I actually have that would measure something similar? The kind of researchy way of saying that is like a proxy measure. But I think in evaluation, you're doing evaluation for your program learning, right? So if you say that programmatic piece is useful for you to know, it is useful for you to know. And some of that also just comes from evaluating over time and knowing what you're going to do with some of that data on the back end as well. So I do think some of it is when you're green and new to it, nothing seems like it makes sense, but then you do it a couple times and suddenly that data, you understand what your data means, right? Like you have a very good sense of, oh, well, 80% of our training participants said they really liked the program, but only 10% of them actually said they knew how to implement bystander intervention. Well, okay, one of those is a really good piece of data and one of them shows me that my program's not doing great. So what am I going to do about it, right? So I always pick more straightforward common sense indicators that are actionable to the program. Man, that was a really great question, Mac. Thank you.
Thank you. And Natalie dropped a question into the chat. What tips and tricks do you have to evaluate a program that has been through significant changes during the time frame that you're examining your evaluation?
Great question, Natalie. Thank you for asking. So yeah, I would say it depends a little bit on, has the program changed so much that their logic model, work plan, any kind of their foundational program documents no longer reflect reality? Because if that is the case, I would start the process over, right? And say, okay, so what is the actual program that we're looking at then, right? So I know it's a little bit different in healthcare settings than in traditional public health or human services, right? But if I say, oh, hey, the point of my program is to prevent type 2 or increase screening for pre-diabetes and prevent complications for type 2 diabetes, right? And my program all of a sudden shifts from that to being only about nutrition and has no other programmatic foundations because our funding got gutted and I can't do any of the referrals or physical activity or any of those medication management, any of those things that I wanted to do. Okay, well then that's not a program anymore, right? If none of the things that you thought were going to happen are there anymore, go back and rethink about some of those program things. If I will also say, particularly in healthcare, sometimes you have to show that those things didn't happen as a first step to say, let's go back to square one. So in that case, I would use a lot of what we talked to in the formative evaluation and process evaluation space and do, I would probably use some like qualitative things, right? To show, hey, we said these things were going to happen, but they didn't happen, right? Nobody got a referral out to Weight Watchers. Nobody got a referral out to their pharmacist for medication therapy management, right? Like these parts of our program that we say are essential to following this program model aren't happening. And then use that data to go back in the process. So it's always, you're always in that flow, right? You're always someplace in that circle, right? So it's really trying to figure out what do I need to level set and get back to square one.
Any other questions from the group?
Caden, I know you have a question. You should just ask it.
How did how did you know?
I sensed it. And my spidey sense was tingling.
Well, thank you for the great presentation, Anne. We talked a little bit about, but are there any plans maybe in the future to do another session about activities-based evaluation, or what your initial initial tips are for just on call today?
Yeah, so I saw Caden a couple days ago, for those of you who don't know, but I know some of you are also just interested in activities-based evaluation. We could definitely think about doing a special session on that in the future, and there might even be additional folks besides me who might have things to say about it. I think the thing, what I might do is I know there's a little group of you who are interested in it, so I kind of have I have like just a file of all my resources that I will probably send to you that I probably said I would do last time and I forgot to. But Jess, so generally activities-based evaluation is just a way of kind of turning everyday activities or parts of your program into data, right? So observation is one of the clearest and kind of like most easily implemented forms of that, right? So if I know, oh, hey, I'm going to have, as part of my sex ed class, I'm going to have kids role play how they would navigate a situation around condom use or contraception or something like that, right? And then I'm going to have my, the people who are implementing it grade each of those role play interventions, right? It's, once you have that on the back end, right? It's data the same way a piece of survey data is, right? And so it's all of activities-based evaluation is just switching our idea about when data and how data is collected. So it is a lot more time intensive on the staff is the biggest thing that I would like want people to know about it, is it can be very useful and can be very great, but it takes a lot more effort than handing somebody a survey. But yes, I will send you everything I have about activities-based evaluation, because I do think it's really cool and really neat and not something that gets talked about enough, especially in the youth space. So yes, I will send you what I have.
Thanks for the quick insights, though. I
You're welcome.
appreciate it.
Wonderful. Well, thank you very much, Dr. Abbott, and thank you so much for everyone who persisted through our technical difficulties today. We will work to hopefully like combine these two recordings and get them posted on our website. And again, thank you for both of your sessions, Anne. This was awesome, and we really appreciate your contributions here. And onwards and upwards, everyone. Thank you very much.
Yes. Good to see everybody. Thank you for coming.